Okay, ladies and gentlemen, welcome back. I kindly give the floor again to my colleagues in Rome in order to finalize the first session, the last presentation, and we will continue with the presentations of the second session. The floor is yours, gentlemen.
Okay, thank you very much, Colonel. This is the last presentation of the Italian contributions. It is a great pleasure and honor for me to introduce Brigadier General Claudio ZANOTTO from General Directorate Joint Military Medical Service, who will speak about the military health system in COVID-19 era. Please, General, the floor is yours.
Okay. Good morning, everybody. Please forgive me for my being a little bit late and for asking you to postpone my presentation. Dear Chairman, dear guests, dear Theodoros, I'm quite proud to be here, and I'll try to explain what our military health services have been facing during this pandemic since its first and unprecedented outbreak. I declare no conflict of interest, sorry, in my presentation, unless I'm a pharmacist, so you will please forgive me if somehow this peculiarity of my professional approach will be evident during the presentation. Next slide. Okay, here you have a general overview of what I'm going to tell you about. Next slide. These are the current figures we are now facing in Italy. We have a huge and very high toll of deaths. And of course, please, what I would like you to understand is that this death shouldn't be compared to our population unless you don't consider the concentration and the density of this population. And you can see the yellow spots on Italy, and these spots of high concentration are finally and probably a big evidence of how the concentration can influence the toll we are paying in terms of death. If you look in the lower part of the slide, you can also see these 19,706 people from the medical services who are suffering or at least even dying because of the disease. These are numbers and figures related to the last 30 days. Next slide, please. The current pictures are also quite a little bit different from the one you saw on TV probably during the first outbreak of the pandemic. Now you can see these ambulances somehow lining and queuing because of the peak in ambulances request. All our people in the second wave, as the second wave started, were somehow scared about what was going on and a little bit abandoned by what we would have expected by our medical assets on the territory. Next slide. You can see a parallel peak in requests of ambulances and intervention of our medical services, either in the first both in the first wave in March and in the second one that started middle of, I would say, October with the opening of the schools. Next slide. Here you see the surprising impact we had on the first outbreak, where the pictures were quite different, and where we were used to be and to see these sad images of trucks carrying coffins rather than people ready to be somehow followed in our intensive care units. You see also on the left a model which we will explain in next slide on how we were obliged to face the situation of a certain number of ICU beds, limiting, in fact, our support to our population. Next slide. Of course, we had a very early stage reaction on end of January, as most of you had in their countries. Our Council of Ministers declared a 6-month, that was the beginning of the emergency, as a consequence of the health risk related to the coronavirus outbreak. Our Surgeon General, the Italian Joint Operation Headquarters, and the Civil Protection in Italy were all sitting at the same crisis table. Next slide, please. Those are more or less the people involved. Dr. Angelo Borelli was entitled the chairman, I would say, of the civilian protection emergency table. But nevertheless, we were confronted with the necessity to rescue and assist our population, and then, of course, especially at the beginning, with the repatriation of our personnel, either deployed or scattered all over the world, and finally abandoned to their destiny. Next slide. These were the something you probably know, because in the phase 1, we were somehow confronted with the necessity either to do nothing, either to try to mitigate, or with the lockdown we accepted to introduce during the phase 1, try to reduce the problem somehow by the problem we were facing with the very low number, or the limiting, I would say, number of ICU beds, which was limiting our possibility of intervention. Of course, we decided to apply this hammer phase in, let's say, the intention to reduce at least the reproduction number RT into some into limits that were more easy to be faced. And of course, we were ready in a second phase due to this RT, but also different parameters we will see later on in my presentation. We try to dance in a second possible phase where RT below 1 would have allowed us to rely on a more, I would say, facilitating situation. Next slide. Thank you. Now, this is very important. You see on the upper right side, a spotted Italy, somehow bleeding, because you have different tonalities of red, but these tonalities are depending on the different parameters which are taken into consideration to attribute to a certain part of Italy, region, or whatever municipality a risk that can be measured, so that you can adopt the subsequent measures, I would say, to prevent any problem. But nevertheless, you see there on the left a list of what are the parameters our authorities and even in the military were considering to assess whether or not and at which level a certain part of our territory is to be processed. Of course, the other thing you see in the bottom in the right, the testing capability, the possibility to trace our people and then to treat it consequently is very important, and all related to all these parameters. You've seen there that we have 4 scenarios, 4 corresponding scenarios, and I will try to detail them in the next slide. Starting by the next slide, you have a very low risk. Thanks. Slide. No, okay. Okay, there you see it's a little bit, figures are quite slow, but nevertheless you have different colors. You have 3 scenarios numbered by from 1, 2 to 3A and 3B, and all the parameters you've seen in the previous slides are here detailed into specific figures that permit us to describe a scenario of intervention. And yes, next slide. There you have a first scenario and some regions following into this scenario, and of course, growing the situation is going higher and higher in terms of criticality from 1 to 2. Next slide, please. In these slides, you have the worst scenarios, the ones that make our country become red in the spots where these scenarios occur, and then these scenarios occur where the sustained and widespread transmissibility, so I'm talking about the reproduction number, is growing higher than 1 and starts or sparkles a kind of an initial risk in maintaining the stability of the national health system. And then you have the worst scenario, the B scenario 3B, where the uncontrolled transmissibility with severe criticality is expected for the national health system, which is assisting that part of Italy. Next slide. There you have somehow a very interesting slide where the criticality of 30% of the ICU bed is considered a factor to somehow delimitate a kind of a point to consider to delimitate the risk of the kind of region. But what I would like you to observe is that at the beginning of the pandemic, when we have our first outbreak, we were relying on up to 2.63 intensive care units per 100,000 inhabitants. Further on, with the activation of our national health system, we pushed this number to 70,092, the number we are relying on currently, which means 11.8 per 100,000 inhabitants. And we are looking forward to realizing the 8,500 number of total ICU beds to rise up this 11.8 to 14.8, 15 per 100,000 inhabitants. You, just to have a comparison possible at this level, consider that Germany had 22 per 100,000 inhabitants at the beginning of the first wave of the outbreak. But nevertheless, the effort is provided by our national health system and our nation to grow up in these terms. Next slide. The other thing we are controlling, okay, is the evolution of the reproduction number. We currently have a national RT between 0.8 and 0.9. You can see the different regions with minimum and maximum RT. And of course, as an average, you can see that most of the big points, the big dots, are on the left side of the dividing line of which we have at one level. Next slide. So this said, just to sum up what our military health services provided during this pandemic, and most of these the slides you're going to see, you have already seen during Alberto Torres, for instance, previous presentation, but you will see that you will have in a few slides all our efforts, because we committed our defense into a very huge and comprehensive health. And then, of course, we had, in the same time, the need to adopt measures to limit the spread of COVID-19 within our military, I would say, armed forces, and of course, of the military, subsequently the medical services, the military medical services forces. Next slide. There you have the main areas of intervention where we could provide our effort in terms of personnel, transport, support to the national health system, of course, and support to local authorities and civil protection. Next slide. To sum up, you have more or less what we provided our medical service with. The first thing, of course, a network of medical assets and teams deployed all over the country in support of the national health system, with a specific attention to residential and nursing homes for elderly. We provided and deployed over the country a network of testing laboratories deployed all over the country, number of 10 and 4 mobile units in a joint, I would say, approach to this problem, because all armed forces are involved in providing personnel and assets for this purpose. We, of course, adopted different protocols to send and redeploy people from areas of operation, full support, of course, to the national health system. And then we converted and transformed 2 hospitals, 2 military hospitals, one in Milan and one in Rome, into COVID-19 hospital capability. Of course, the logistic capability in terms of procurement of PPEs, pharmaceuticals, and disinfectants and whatever was provided and somehow squeezed from the assets in terms of, I would say, industrial assets we already could rely on within our armed forces. Next slide. Okay, there you still have what happened in terms of personnel, and also we asked for temporary recruitment of new personnel because, and this due to the lack of nurses, doctors, biologists, and whoever else in terms of specialty we might need, both in terms of quality but also in quantity within our medical services. Of course, a huge campaign of information, equipment, and support was as part of during this time. Next slide. There you have, of course, in terms of transport, a lot of things, including the possibility to evacuate people in the containment, which was specifically detailed by Colonel Autore, but also we had some typical logistic lifts to send and transport PPEs all around the country. Next slide. Thank you very much. There you have the support we provided our national health system with. Go on, please. Of course, the Italian defense commitment. I described most of these operations. The other thing I would like to insist on is that we already had lots of people deployed because of terrorism, and within our resilience in terms of NATO commitments, all these people were somehow converted into the possibility to support the outbreak of the pandemic and to support our nation with their presence all around the country in the main streets of the main towns. Next slide. Now you will see different slides you were already somehow described before by other people, so I'll go on like kind of a rapid presentation. Next slide. This is just to tell you that we can, as armed forces and with our defense, we can rely on a very, very important industrial asset belonging already to the Ministry of the Defense. These assets were somehow dormant, I would say, especially those with which have had in the past mechanical or not, I would say not medical importance, but all these industrial assets were turned somehow into, for instance, the production of life-saving ventilators, which were kind of a shortage during the pandemic. Next slide. We started to produce personal protective equipment in terms of masks, and of course, in trying to somehow denude what was the problem with these assets coming only or exclusively from China. Next slide. Our MOD pharmaceutical industrial facility was involved in stockpiling of strategic assets, production of disinfectant solution, production when required, and when our Ministry of Health authorized the use of hydroxychloroquine in the beginning of the pandemic for the clinical trials, we started and produced hydroxychloroquine in our facilities. Next slide. And this, all in all, is kind of a summary of all the opportunities and the efforts and the services we provided as the Italian defense system as a commitment in help of our nation. Next slide. Now, to come to the current, I would say, efforts we're providing, there you can see a few slides where we started providing testing capabilities for all the population, in addition to the one we provided to the military population, and these centers are scattered all around the country with the ability to test up to 30,000 tests per day. Next slide. There you have another, somehow summarizing slide with regards to the measures we adopted towards our military population, especially in terms of reducing people at work. But you probably know all this by yourself, because all your nations and all NATO nations or whatever are somehow facing and adopting the same measures. Next slide. Stiamo quasi finendo, perfetto. Now, we are now currently facing the next challenge. We have, and we all know that the EU has a vaccination strategy, has provided us with different contracts to somehow concentrate vaccines and distribute them all around the countries. Our effort will be to provide this possibility until the very last of our citizens. Next slide. And this is just to summarize how this challenge in terms of logistic pipeline will be dealt with by our military medical forces, but a very, very huge effort was asked to our logistic chain to provide all our medical assets with the distribution of these vaccines. Next slide. Vaccines. There you have the different types, and of course, these vaccines in the pipeline will imply differences in the holding capability and a lot of things you are probably getting more and more involved with as a single country as well. Next slide. There you have all the things. Next slide. Different consideration with regards to storage, I would say restrictions or whatever measures to make our people, or at least all the vaccine that will be distributed, liable for the distribution. Next slide. Next slide. These are the in terms of quantity, what will be distributed in the countries, and I think this slide is very interesting for those who would like to know a little more about what will happen in the coming days. Next slide. Okay, there you have some references, and there you have our weekly medical situation awareness report. Our directorate is providing our armed forces with to assess all the parameters and all the consideration I've been doing during the presentation. Next slide. And this concludes my briefing. And I don't know if you have any questions, but what I wanted to do is to provide you with something you can refer to and to probably recognize what you are doing on your own side as a single country, because I'm sure that with different slightly approaches, we are all facing the same challenge and the same, I would say, opportunity to help our nation and our citizens with the best service we can give them to fight this virus, which has so changed our habits and our economies currently. Thank you for listening to me. I just somehow took some minutes more than expected, but thank you very much for giving me the opportunity to be in this community.
Okay, thank you, Gero, for this valuable, very interesting intervention. I don't know if there are some questions from participants. Otherwise, we can move on, leaving the floor to Colonel Balsamidis for the start, for the beginning of the second session. Before leaving the floor, I would remind you to participate in our two surveys. You can go to menti.com and use the code number you can see inside the chat box. Now is the moment of the Colonel Balsamidis. So please, Colonel, the floor is yours.
First of all, I would like to thank the General for his time and also for his very informative briefing he has provided to us. Thank you, General. And also I would like to thank you as senior officer that I see in your country for the immense support that your colleagues and your personnel has provided to this activity and this webinar. It's much appreciated, and I thank you, really thank you for your contribution